Hello, this is a presentation on an audit that was completed in Cork University Hospital by myself, Dr. Jenny Fitzgibbon, and aided by Dr. Parvaiz Hafeez, both doctors in the Department of Anesthesiology. The audit was on the completion rates of form number 64, which is a pre-operative assessment form that exists here at Cork University Hospital. The objectives of the audit were to evaluate the completion rates of the form, to evaluate how many of these were partial versus full completions, and to make observations as to why forms were or were not completed. The methods used are outlined on the slide here. A form could be either partially or fully completed. Partial completion was gained if any information at all was on the form. Full completion was as if all of the criteria that are listed in the slide here were filled out. The standard was 100% completion rate, and the criteria are outlined here. 48 patients were involved. The results included the rates of completion to any standard at all were 35 out of 48 patients, which is a 73% completion rate. Of these completed, 17 were partial and 18 were full, so almost a 50-50 split. The conclusions gained from this audit were that rates of pre-induction completion were reasonably high, but were very often partial completions. Between induction and moving the patient to recovery, the patients often had more information added to the form. The most omitted information was thyromental distance and neck movements / mouth opening, which is known widely to be a significant risk factor for difficult intubation. The conclusions I personally drew from doing this audit is that there's scope for further audits as to what information is generally left off of the form and what is included, and also as to why there are a few reasons that I received anecdotally from other colleagues. As this is very brief, I will not go into them completely, but I would like to potentially audit these further in the future and present my findings again. Thank you very much for listening.